My name is Christine Belmore. I'm a registered nurse and I've been working on the COVID unit for the past 10 months. Just the fear of bringing this virus home to my family, which actually did happen to me. I got sick with COVID-19 and brought it into my home. And just the guilt of thinking, how did this happen to me? Did I do everything I was supposed to do? It was just very stressful to think that I brought this into my home and my family got sick.
The worst part of this year is that it changed everything. My name is Jeanette Chang, and I'm a registered nurse on the COVID unit, and my colleagues and I have been taking care of COVID patients for almost a year.
I remember the first time I stepped into the COVID ward was just having that mixture of a little bit of excitement and a little bit of fear, and how the nurses just made me feel right at home. We have a very different experience. We're on for 1 week and then we're gone and then we come back a little bit later. But the nurses, they've been there for weeks and days and days in a row. For them, this is everyday reality, and just really admiring them for their persistence and their bravery.
If we look at our COVID units at the Ottawa Hospital, both units were actually conversions of surgical units. So these were nurses who were used to looking after surgical patients and had expertise in that, who had to totally shift gears and start looking after these very medically active patients, and had really none of us had any background about how that was going to go and how we were going to actually treat those guys. So we had tons of uncertainty, not knowing what to expect, what the pattern was going to be. And that's really hard to be taken out of your element in medicine. I think all healthcare professionals, whether you're a doctor or you're nurses, you're all about pattern recognition and knowing what your bread and butter is. And when that suddenly gets turned totally upside down, I think that's really hard.
Hi, my name is Vanessa Large. I'm a registered nurse at the Ottawa Hospital, and I have been a COVID nurse since March of 2020. Dealing with patients who were not doing well in complete isolation while being fully gowned in PPE, and talking to an ICU team through baby monitors as the only form of communication to a medical team. The feeling of isolation is like no other.
If I had to think about what I would tell the nurses, and we have told them numerous times, I would say, thank you. I would say that we know that what you did was different than what we did. I can't imagine spending 4 hours in full PPE in a room with a patient. That was not my experience, and it was the experience for a lot of nurses.
My worst part about this year would probably be seeing a lot of suffering and not being able to help as much as I would want to. Hi, my name's Michael. I work on B2 at the Civic, general surgery. I've been working there I'll be 6 years in June.
Hi, my name's Leah Mills. I'm a registered nurse at the Ottawa Hospital. I've been working on the COVID unit for almost the last year. The worst part of my year was one particular day at work where a patient passed away. I left work, came home to an empty house, and realized that I had not processed the death at all. It was then that I realized that I had become numb to these events after seeing them for so long.
The worst part about the pandemic for me, or the past year for me, has been just the general uncertainty of it all. Working on the COVID unit, with the numbers going up and down, you never know which point is going to be the tipping point, and if there's going to come a point where we're overrun, if we don't have any beds, if we're not able to offer the services that people need to everyone who comes in. So that's been a really challenging point of the year for all of us.
The worst part about this year was the unknown, graduating from nursing school only 8 months ago and coming to work on the COVID unit. Seeing COVID on the news and reading about it isn't the reality that we see every day. There's a whole other side. I'm Margaret. I am a nurse on B2 General Surgery, and I've worked there for the last 8 months. Best part about starting on the COVID unit was the team. Everyone was very supportive, willing to teach the newbies on the unit, and the patients especially, they were very accommodating, and I will remember them for a long time to come.
The best part of this year is that COVID has taught me to really value and cherish the time that I have with my family, friends, and my colleagues.
The best part of my year was sending long-term patients home who we've cared for months and sending them to their families.
The best part about this year would probably be working alongside a great team, a team of surgery nurses, intensivists, and seeing our efforts actually paying off.
The best part about this year, I would say, is getting vaccinated. It just brought a lot of hope for the future.
The best part of my year was the day that I received the call that I was going to book an appointment to get vaccinated. I was so full of emotion. I broke down crying in my kitchen, and then my boyfriend did as well, and then we called my family and they all cried too.
So I got to work a lot on the unit, and we got to form really strong relationships with the team up there very, very quickly. I think there is nothing like a crisis to bind people and like to create these really very strong, immediate connections.
What keeps me coming back every day is reconnecting with my colleagues and knowing that when I get back to work, there's a sense of purpose towards my patients and knowing that I'm their resource to get better.
I just want to say thank you for all you did. And it did not go unnoticed. I'm not the most verbose person at times, so if I forgot to say thank you, thank you.
What keeps me coming back would be living out our hospital vision. I think if you put that at the core of your practice and picturing your loved ones in those beds and delivering the care that you would want for them, you can conquer a lot of things.